So my personal trajectory is funny and unique in that my mom is a retired registered nurse, and she used to work in the psychiatry department and had a lot of fun contact with OTs. And my dad is an acupuncturist, and he has his own small business where he practices alternative medicine. And growing up, it's interesting because I grew up with parents who were both in medical fields, but very kind of different philosophies of medicine. I was not interested in rehabilitation sciences or anything like that in undergrad. But after undergrad, when I moved to Turkey and as I was an educator, I realized that one, I loved working with people. Two, I really wanted to help people that were not able to develop their potential. So when I interacted with some refugees and some individuals with disabilities who just life for them seemed like it couldn't get any better. And I was just thinking to myself, how can I help them? And so I got to thinking about occupational therapy because in this program, we learn a really good mix of theories and methodologies, but also hard skills, so clinical skills. And all that came together with just with my desire to move back to America, and now I'm here. So when I was in Turkey, I was thinking through my next professional steps, and I just did a really quick internet search on OT programs, and I learned about the different types of programs, so OTAs, the masters, the doctorates, etc. And I just thought to myself, I just want to go all in. I want to go for the doctorate. And so I applied to 2 schools and, ended up coming to Boston University. I think that diversity in OT means that you walk into a clinic or a hospital or a school setting or wherever OTs are, and you see someone who looks like you and who has a similar experience as you, and someone who knows what it is like to be working on emerging skills or working on rehabilitation goals. In terms of next steps of where I see diversity, equity, and inclusion going in terms of occupational therapy, just speaking from a student perspective, because I haven't been out in the clinical setting yet, I think that having a mix of experiential learning and learning in the classroom is ideal. Catering to different learning styles. So giving a mix of exams, practicals, assignments, group projects, also having volunteer opportunities for people to be able to meet other people in the community, to be able to network with clinics. I think that would be ideal. I also think that without an individual feeling like they belong, then the other pillars of diversity, equity, and inclusion don't mean much. So somehow a next step would be to somehow make an occupational therapy student feel like they belong to the program and to the profession as a whole. Speaking as a person of color in a predominantly white-dominated field, it can be hard to feel like I belong. So I'm not really sure what concrete ways there are, but having a place to just be able to talk about some of the struggles or to ask, difficult questions to find my place would be really meaningful. One of my favorite markets to go to, it's in Alston, right off of Brighton Avenue. It's called Turquoise, which is a Turkish market. They sell my favorite Turkish foods that I thought I could never find outside of Turkey, like roasted chickpeas and my favorite kind of soda, my favorite types of cheese, and they even have like a little corner of baklava that tastes like it's right from Turkey. So that's my favorite market on this side of the river. Across the river in Cambridge, there is a really big H Mart, which is a Korean market. And there I could find all of my favorite Korean grocery store items. And they have like a really big shelf of kimchi. They have really just like aisles and aisles of Korean snacks, which are the best. So that makes me feel like I'm right at home. Well, I actually live with a couple of graduate students who are international. So I have a couple of Korean housemates who try and teach me how to make Korean food, but I don't really know how to cook so well. When it comes to Turkish food, I have a Turkish housemate too, and we tried to make some like stuffed grape leaves after buying the ingredients from Turquoise. So that was successful. One amazing housing opportunity I found on campus and about a 5-minute walk from Sargent. It's called Fisk House. And the Fisk House is a subsidized housing opportunity for female graduate students. And it's sponsored by the Women's Guild. So rent for the semester is less than $2,000, and you pay that as a part of your tuition. So that's the residence that I live in right now. And it's really nice because I live with about 15 other female graduate students who are in different fields of study. And it's kind of a nice respite away from Sargent, but it's also really close by. So I can, wake up, change my clothes, brush my teeth, and then be right in class in 5 minutes. I think that there are many opportunities for conversations about occupational justice, um, but most of these conversations happen with friends and colleagues outside of the classroom. The BU community has a couple of wonderful centers that offer opportunities to continue the discussion. So I'm thinking about the Howard Thurman Center um, down the street, which has really wonderful events centered around diversity, equity, inclusion. A center that I've become close with this year is BU D&I, which stands for BU Diversity and Inclusion. And through them, I was able to secure a small grant to start a book club here at Sargent. So basically, in our book club, we have been reading a book called Disability Visibility by Alice Wong, and it's like 30-something short stories of different disabled artists, activists, writers. And in this book club, students from the OT program, PT program, SLP, nutrition, we all come together about once a month and talk about the stories and how they impacted us personally, or just different ways in which we can think about disability. Disability is it's a really big part of the rehabilitation sciences, but I appreciate being able to talk about these things just not from an academic or not from a clinical standpoint, just as people who are interested in working with these populations. I do think that BU itself, it does have opportunities to continue to advance these conversations. I think Sargent does as well, but it is up to the students to kind of take that first initiative.